Good morning. Good morning, everybody. Happy December already. We're already here at our last Windows on Waterloo of 2024. And I'm already struggling with, I'm still thinking 2023 sometime. Like I said 2023 the other day, and then I'm like, we're almost to 2025. I really need to live in the now and pivot a little further here. But we are so excited to see you all here. Hope everybody had wonderful Thanksgiving and are already kind of jumping in on the Thanksgiving to Christmas pivot just felt really fast this year because all of a sudden we were in December and here we are. But we're excited to have you all with us as we kind of prepare to close out the year here. So if you don't know me, my name is Paige Price, and I'm the program manager here at the Waterloo Community Foundation, which means that I get to host our monthly gatherings here for Windows on Waterloo. And we host these on the first Wednesday of every month as a way both to uplift and kind of give a platform to some of the great things that are happening around our community, whether those are nonprofit organizations or just things happening around our city. But it's just a great place to be able, as community members, to learn more about community issues. And a lot of times there are concepts or things that we hear, but we don't actually know what that looks like locally or what's going on in our community with some of these things. So it can just be a great place for us to gather and learn more together. So we're excited that you're here. I'm really excited today to have Joni Spencer and Brooke Olson joining us from Success Street and Together for Youth. I always love hearing from people that are in our schools and that are working with youth because I think it's just such a microcosm of our community that these folks really see how community trends and issues and things like that are impacting us. And so I just always feel like they have such great perspective, not only on they're going to share about their incredible programming and all the resources that they offer, but just kind of knowing what's going on and what youth are facing, the challenges and the successes and all of those things. And so we're really excited to have them here with us to share more. We do hope to have time at the end of our presentation for some Q&A as well. So if you have questions that pop up as they're talking, you are welcome to throw those into the chat, or you can wait until the end and we can have you unmute and all of that stuff as well. But just know that there will be an opportunity for you to ask the questions that you have and just glean more from Joni and Brooke's expertise and experience here. So with that, I will go ahead and turn things over to these ladies. Thank you so much for joining us here today.
Thanks for having us.
Yes.
I think while you introduce us, I'll share our PowerPoint here.
Alrighty. Well, while Brooke is getting that set up, we would just like to thank Paige for inviting us. My name is Joni Spencer, and I manage the Together for Youth and Success Street services. I'm here with Brooke, and she serves as our resource director at Success Link. So what we'd like to talk to you a little bit about today is Success Street, Together for Youth, and then also Success Link. What we want to share is that Success Link is our overarching organization, and many of you may know Brad McCullough. He is our executive director, and Success Link has 4 very unrelated things that go on underneath the umbrella, and I just wanted to give a little overview of that first. So the mission of Success Link is to provide support services to organizations and institutions in the Cedar Valley. And under that umbrella, we have data gathering. So Brad works with youth serving organizations and area schools to track outcomes. So programs can tweak their programming to see increased and improved outcomes for the youth that they're working with. And then he also serves and contracts with other organizations that might need assistance with their financials or HR that might not have a 501c3. So that's another part of the Success Link organization. And then of course, Together for Youth, which focuses on adolescent sexual health and then teen parenting support and education for our youngest families in the Cedar Valley. Our youngest families with the youngest kids in the Cedar
Mhm.
Valley attend our YPT program. And then Success Street falls underneath that Success Link umbrella also. Brad's been doing this work for over 30 years in the community. And he's not here today, otherwise we would have made him pop his head in, because he's really created an incredible organization that our community is able to do so many things when you work with and under the umbrella of Success Link.
Mhm.
So I want to talk a little bit about Together for Youth first, then I'm going to pass it over to Brooke to talk about the programs. We've been around for a long time. Brooke and I don't know if you know this or not, but I added up the years that we have been
Oh,
involved
no.
and also working behind the scenes, and it was 55 years. So we've spent 55 years together working on.
Wow.
We're old.
We are, yeah.
We've been working on these programs for a long time, and if it takes a collaboration, and true collaboration gets mucky at times, but when you have a strong collaboration and you have those difficult discussions that need to be had to create incredible programs, you see results. So our coalition started way back in the days, and many of these names might sound familiar to some,
Hmm.
but Pam Hayes, Floyd Winter, Bob Bamsey, Julie Pitson, Jeanette Debs, Sandy Kaler, some of those names might ring some bells to you. And we were able to work alongside with them and learn from them. They passed the torch to us, and now we are doing the best we can and probably going to be passing the torch in a
To
couple
younger
decades here.
people.
Oh, younger people.
Yeah.
Anyway, I wanted to make sure that you guys knew that Together for Youth has been around a long time. And again, collaboration can be difficult, but when it works, these are the results that we get. And we're going to talk a little bit about the results as we get into this program and talk about the data. So we're going to take you back to about 35 years ago. If some of you were even born at that time, I'm not sure. But I was actually involved in the program at that time. And the legislators in Iowa wanted to invest in communities to help young people prevent a subsequent pregnancy. That was kind of a safe way to address teen pregnancy. And we've created the $1 a day program. So we provided $1 a day for each day that a young person prevented a subsequent pregnancy. And we had one of the highest teen births at that time. And we'll talk a little bit more about that later on in the presentation. But if you could imagine 264 teens for years on end delivering a child in Blackhawk County, teen pregnancy was very visible when we started these programs. We were the highest ranking county in Iowa, 14 births. And we brought this coalition. The legislator said, hey, bring a coalition together, address subsequent pregnancy preventions. That's exactly what we did. In the mid 90s, they recognized that, hey, you know what? We need to invest in our communities. If they build a coalition, build a net of programming, and address initial pregnancies. So that's when we get to really expand our program from a teen parenting support group to all of the prevention work that we've done. So that's a little history, and it ages us, but we've kind of been through the ringer a little bit. So yeah, I talked about how visible teen pregnancy is. We are going to talk about the data, but just a little sprinkle of good news is that our teen births have really went down in this county these last several years, and we get to share that little nugget in a little bit here. Gosh, you make all these notes and then you just kind of skip around and do what you want to do. I'm going to have Brooke talk a little bit more about the specific programs. And on the side, if you have a sticky note, just keep track of any questions you might have for us, and we'd be happy to answer those
Absolutely.
afterwards.
Absolutely.
Okay, go ahead.
So Joni talked about our state funding, realizing that we needed to prevent initial teen births. And so we, over the last 30 years, have really created an incredible package of adolescent pregnancy prevention programs to prevent initial teen births. And so it is the largest program that we offer in the community is our classroom adolescent sexual health education. Together for Youth, we do serve a 4-county area. So obviously Blackhawk, Bremer, Butler, and Buchanan are also counties that we're doing a lot of programming in. But our health educators, again, I'm going to throw a large number out. They have a combined history of over 30 years of providing adolescent sexual health in our community. They are certified and trained through our state coalition, which is called Eyes Open Iowa out of Des Moines. And our approach is to provide comprehensive, age-appropriate adolescent sexual health education. And so every time we go into the classroom, before we go to the classroom, we're working really closely, building great relationships with the teachers in that classroom to say, what are the needs of your students? And making sure that we're addressing topics with them that cover abstinence, but also talking about contraception, STDs. We do a lot of give a lot of information and talk about consent, healthy relationships. We actually have started including, we've provided information about the safe haven that are in our communities, talking with young people about communication. Our young people, they're online, they're on their phones, they're on social media, talking about, with communication, sexting and some of the consequences that that may bring. And also making sure, because we have a finite amount of time with those students in the classroom, that when we leave, they know what their community health resources are. And one of the things that we give every student that receives our programming is this little What's Where for Teen. Can you guys see it? What's Where for Teen adolescent sexual health card. There we go. But you can see it's a little billfold size card. And all of these resources are local to our community. They're teen friendly, but it ranges from where they can get mental health counseling to substance use prevention, teen parent support, sexual assault, dating violence. We do have some social media sites on there as well. But again, just making sure that not only are they educated about their health, but that they also know their resources when we leave the classroom. And that's really important too. Were you gonna say something?
I was, but I
Go
didn't want to
ahead.
interrupt.
Go ahead. Go ahead.
I feel like we're on a podcast or
Yeah.
something. This little card is really nice for adults to have in their office also. I don't know if you can see that very well, but when I go around in the community to youth serving agencies and schools, I see them on teachers' desks, the Boys and Girls Club, the YW, all of those facilitators that are facilitating programs, have those cards, and we update them every year. It's probably the best $400 or $500 that we can spend. Again, educate.
Great.
Linking kids to services is sometimes the step that is missed. So that's something that we've done for probably over 20 years, and every year it's a different color. So if you have a yellow one from last year, you need a blue one for this year, because we have to update them every year to make sure that the numbers and the sites and the QR codes, things have changed in 35 years.
Yeah.
There are QR codes now that teens are using all the time. Sorry to hop in. Yeah.
No, that's great. And there's dates on the cards too, in case you have to check if you have the most recent one. Something that Joni and I realize when we're doing presentations like this with our peers in the community, or we're talking with parents, or also I think about our health educators going in and what they're talking about and educating teens about. None of you are spending your workday talking about adolescent sexual health. So we realize that while we do that day in and day out, most people don't. And so it isn't necessarily one of those that you put on the list and say, that's a really comfortable topic, right? But the beauty, I think, of our health educators is they make this topic very conversational, very comfortable for the students. I've sat in on their presentations, and they also do an incredible job, because students aren't going to be comfortable asking personal sexual health questions in front of their peers in the classroom. So we make sure when we're in the classroom that we have a question box that students can write a question down anonymously. All of those get answered by the time Jean leaves the classroom. for however long that series happens to be. But then, and we'll get into this on the next slide, but we have an individual health education program that we introduce to students in the classroom. So if they're not comfortable asking a question in the question box or raising their hand, you know what, you can come down to Success Street and we have health educators that will talk with you confidentially about, whatever it is that you need to talk about. So I think
Yeah.
it's important to
Well,
recognize that.
And to build on that, we want to be available to parents too. Rarely do we get a call from a parent that says, hey, how can I talk to my young person about sex, sexuality, birth control methods? But things have changed. You know, 30 years ago, the majority of people were on the birth control pill. Practicing abstinence on the birth control pill, we talked a lot about condoms. But now, these days, there are long-term methods of birth control. And we found out when those came on the scene that some of the teachers weren't even covering those in our classrooms. And when we sat down with them to talk about what we would cover, we found out that they weren't even talking about those methods of birth control. So it's great for all of us to know the current trends and research on these topics. And that's what we can bring to adults, to parents, to teachers. We would love it if a parent called in and said, do you have any tips on how I can talk to my young person about healthy relationships, or how do I even start this conversation?
Right.
So those are things that we wish we got more calls about.
We mentioned earlier that we serve a 4-county service area, but because we're on Windows on Waterloo, and really Waterloo is the community that started this programming and gave us the platform and the support to do this work, we wanted to make sure that you guys knew that the Waterloo schools, when a student, by the time they graduate from Waterloo schools, they will have on average about 8 to 10 sessions of our programming. And that's just classroom sexual health education. That's not if a student comes down and accesses our individual health program or as part of our Soleil group. We'll get into some of that. But because of the support we have with administration in the Waterloo schools, when a student's in middle school, they get a series of our health education programming. They come into our high schools, they get another series of programming. And actually in the high school alone, East, West, also at Expo, they're getting just in high school about 6 sessions of programming. So I just wanted to that's really important. And I think it just shows the trust that our health educators have built within the schools and the people that are working in the schools every day. We also do a lot of programming with youth serving agencies. And a lot of times these are young people who are out of home placed. And so if you think about a young person who's out of home placed, they may be in and out of foster homes and then also youth serving agency or the mental health institute or the detention center. Those are some of the locations we're doing regular programming at. So then they're in and out of the classroom. So it's critical that we're providing programming to those students as well.
I was going to hop in
Yeah.
too, and I know that this is something that our community has focused a lot of time and energy on this last year or two, is the programming that we've been providing to young people regarding sexual abuse prevention, child abuse prevention. And we kind of went through our programs this last year to see what we were actually doing in that on that topic. And we found that over 350 of our programs annually are child abuse prevention. And these presentations are reaching sometimes 20 to 30 children, students in a classroom. So we cover topics such as consent, healthy relationships, the safe haven law, refusal skills, sexting, sexual decision-making. And we just wanted to make sure that all of you that are tuned in today, we really want to focus on those topics and include those with preventing pregnancies, preventing STIs, and making sure that students have access to health and wellness services that we'll talk a little bit about with the Success Rate program.
Thanks for including that.
Yeah.
It's important. And it just, I think, shows too just how, while we are focusing on adolescent sexual health, just how that issue ties to so many other community issues, like you said, like poverty, child abuse prevention. educational attainment, being ready to work.
Mhm.
You can see on this slide too, and Joni talked about these numbers. So in 1994, we had 264 teens that gave birth that year. We had the highest rate of teen births in the state. Our most recent data through Health and Human Services, and I still can't believe it, even though I know the great work we do, is below 50. 48 teens gave birth in 2024. And so another way to look at that is there were 4 times as many teen births in 1994 as there is today. And so I just think that is an incredible community success. So you guys are part of that. Like I said, Waterloo started that with us. And I think it's incredible.
It is.
And it's also a success for our teens. I mean, they're part of that.
When we can help a young person postpone a pregnancy till they're 20 or 21, their lifetime earnings go up. We have healthier outcomes. We help them reach their goals, that we make them recognize in themselves what success is. And there's nothing better. And that's probably why we're in this work, is when you can empower a young person with all this information and resources and see them succeed and see them do the work, there's just not a better feeling. So yeah, that is huge. I do want to say, when we go around the state to conferences, everybody is wondering, how do you guys do it? How in the world did you guys reach this? So we have folks that track data. We have our researchers from UNI and this, Iowa University say these are significant declines for a community. And we're not patting ourselves on the back, because this isn't just us or what we do. It's the administrators that support our work. It's our community funders that provide the funding to do this. It's the young people that are engaged and our health educators that create these incredible programs that they're tuned into. So it's really a community success. So thank you for supporting our work. And when we can have these conversations about, again, this sensitive topic, it helps everyone become aware about how related teen pregnancy is to so many societal issues.
Absolutely. So our individual health education program, so we talked a little bit about how, students aren't necessarily comfortable asking questions in front of their peers in class. And so we have individual health educators, Shauna and Jill, that you can see here, that are located at Success Street at our school-based health clinics, and also go to schools that don't have Success Street as well. But if a student is worried that they might be pregnant, or they may think they have an STD, they can get tested for pregnancy or screened for STIs with our individual health education service. Again, this is a confidential service, but even if a student wants to talk about their relationship, how can I talk with my mom and dad, or my grandma, or my auntie that I live with about my relationship, or how do I talk to them about sex? Our individual health educators, while it's confidential, they always want to encourage our young people to identify if they have a trusted adult. And sometimes they don't, but if they do, how those conversations can get started. And a lot of times when our health educators are in the classroom, they'll bring Jill and Shauna in and introduce them to the students, so the students can put a face to the name. They're more comfortable coming down to Success Street to ask for that service. But our individual health educators are trained to use motivational interviewing when talking with students. And really, it's kind of the opening door to the other services that we offer through Success Street, which I won't go into right now because I know we're going to get to that. But they're doing an incredible job. So, and you can see the numbers there, that we had almost 500 sessions, met with almost 200 young people, served 10 schools with that service alone.
I'd like to hop in here. Sometimes this service is the window to all of the services at Success Street. A young person comes in a crisis. I'm in an abusive relationship and I need to talk to somebody right now. and we're able to refer them to Riverview, Amani, Waypoint, I have been assaulted. I need to talk to someone. I think I'm pregnant. I want to talk to my parents. So usually, um, we're noticing anxiety also, just increased anxiety since COVID, since the pandemic. So these are windows to a huge array of services at Success Street. Usually when someone's in crisis, they get to meet with somebody here. We create this safe environment and we do some screening and then they can access other services. And again, we're kind of leading into Success Street, but go
That's
ahead.
great. It's great.
Yeah.
So we have a program called Soleil. We have a lot of acronyms in this business, and sometimes we speak our own language, but Soleil stands for Sistas Informing, Healing, Living, and Empowering. This is an evidence-based curriculum. It is gender and culturally specific to African American individuals who identify as female, middle school and high school age. Our coworker Shanita coordinates this program. She is incredible. She's an incredible mentor to the young women who are part of this program. So how this got started really back in 2008, so a while ago, is we were sitting down with a community funder, Stacy Van Gorp, actually, and she said, it's incredible the decline in teen births in this community. It really is. But have we looked yet specifically at race and ethnicity and where there may be disparities within our teen births in those communities? And it was like, you know what, we need to do that. We did that. And, unfortunately, what we found was while the overall teen birth rate has declined, we're still seeing disparities amongst our African American females in this community. And so we actually were at a national conference, Healthy Teen Network, and there was a breakout session on this curriculum, and we brought it back to Blackhawk County. Like I said, Shanita is an incredible mentor and educator for these young women. She, for several years now, has done year-long groups at Cedar Falls High School. And so she currently has 2 groups going all year this year at Cedar Falls High School. She works really closely with the school counselors there and has a lot of support at that school to provide that program. And then she also does a Soleil group at Pete Junior High and also at Holmes. But they discuss so many topics: gender and cultural pride, of course, sexual health, communication styles, health resources. So
Yeah,
yeah,
incredible program.
she brings community speakers in as well, and so you can see here every year she brings in Amani, specifically during Teen Dating Violence Awareness Month to talk about what they can offer to students, to talk about healthy relationships too.
I would love to just hop in.
Yeah.
Brooke made an incredible point. Of course, this is an incredible service, but I think you mentioned how important it is to have those relationships with your community funders and to have those conversations. We consider community funders and champions of our programs very important in our work. It helps us remain strategic. It helps us look at how we need to tweak our programs. To have conversations out of our own little bubble is so important. And what that did, that conversation that we had with Stacy 15, 20 years ago, it helped us get to a national conference, learn about an incredible program to bring back to Blackhawk County. And it's just been a great thing for our community. So
Absolutely.
those conversations and relationships are important.
Absolutely. We have a circle program. The curriculum is actually called Girls Circle. It's a young women's empowerment program. It's for middle school and high school age students. We work really closely with the school counselors. They help us identify young women to be part of that program. And it's literally it's a small group of 8 to 10 young women. And we provide about 10 to 15 sessions of programming. We literally sit in a circle, very conversational. They identify what they want their kind of group rules to be for the program, what topics they want to talk about. But again, talking about relationships, communication, friendship, talking about sexual health, of course, different things that are going on at school, um, social media, bullying. Last year was the first year. It was kind of cool. We collaborated. Like I said, we work closely with the school counselors, and we actually had one of the school counselors at Bunger that facilitated that group with us, and that was a cool new element, I think, to that program. Very activity based as well. Um, so
Yeah. Lots of young women, hopping in here again, lots
yeah.
of young girls who participate in those programs then learn about Success Street and can mosey on down for a service. And then once they come in and they find out about the services, they're our best marketers. So they tell their friends, if you're concerned about this or that, or if you're having anxiety, stop in, talk to, create that trusted adult.
I will say that when we've hosted Circle at a school that has Success Street, which is West, East, Carver, literally every student in that group has accessed Success
Mhm.
Street by the time they're done with the Circle group.
Mhm.
And maybe some of them have beforehand. Some of them don't know about Success Street before the group, but by the time they are done with Circle, they've accessed services through Success Street. So Young Parents Together. So Young Parents Together is our program that we offer weekly for expectant and parenting teens and their children. We collaborate every Monday and host the program at the Northeast Iowa Food Bank. This has been an incredible partnership that we've had with them because let's face it, all of our families are food insecure. And so one of the things that we can offer them when they come to group is a nutritional meal for their family. They can shop in the food pantry. During COVID, we actually saw an increase in this program because we offered it in the parking lot at the food bank. It was literally a drive-through service that they came in, got some education, got some materials in a safe manner during COVID. And then we were doing education through Zoom during that time. Now we've been back in person now for several years, but it is designed collaboratively and specifically for teen families and their children. We do have a component where they can bring a support person oftentimes that is a grandparent. And so we offer grandparent support as well. But this program itself is really a collaboration in itself. So every Monday, it's like a parenting fair where we have staff coming from different agencies to provide services in one location for these young families. And so we have education groups. We have an education group for teens who are expecting, and that's led by Janelle, who is a former labor and delivery nurse. She's also a lactation consultant. She's currently a school nurse in one of our elementary schools. She's incredible. Then we have a newborn group for those little babes up until the age of 6 months. And we have a home visitor from LSI Hopes that provides that program. She also is able to do ASQ developmental screens for the little kiddos, making sure that they're on track developmentally, getting them engaged with home visiting programming outside of YPT as well. And then we have a parenting education group for anyone who has children who are over 6 months of age. And Chris, who provides that, is a former long-term home visitor with Head Start. She's supervised at Head Start, and she's incredible as well. So when you think about that, we had 48 teens that gave birth and yet served over 50 teens last year at YPT. There's a couple of things that tells me. One, that the staff, so our coworker Jill that coordinates that program, she's incredible, and the staff there are incredible. They're making incredible relationships in the community, for instance, with Allen Women's Health. So when someone comes into Allen Women's Health who's a teen and is expecting, we get a referral from them to come to YPT. So they're really connected in the community to make sure that they're getting teen parents into the program. We also have a really high percentage of teens who start this program prenatally, which I think is really important as well when you think about prenatal outcomes in this community and across the state. And then also, I think it speaks to the community that has been built within Young Parents Together amongst the teen families and what they've got built and the relationships they have with the staff there too. Because I tell you, once they get engaged and they're coming to the program, they're really, most of them are attending until they can't attend anymore when they age out. And so when they're past the age of 19, they age out. But we offer mental health counseling, mental health screening. And so if they screen high, we can refer them for mental health counseling. Like I said, they can shop at the food pantry. We bring in community speakers to this program as well. So,
I just have to hop in here.
yeah.
Because when you go back to the early 90s, when that first money was funneled into Blackhawk County to address subsequent pregnancies, what we've built from the $1 a day program over 35 years has grown into, you use the term health fair every week. You're hearing words collaborative, connectedness, community. Sometimes collaboration isn't easy, but it's so important if you want to build a program and share resources and make sure we're providing quality programming at a low price. So we have Young Parents Together now that enjoy the group so much that they're wanting to come back and volunteer. They don't want to leave the group. You know,
Yeah.
I'm 20 and I have to graduate. Yes. So we have
But they built those relationships with the other teens, and so we actually have a couple now that are volunteering, and the teens trust them because they've been at the program together. We also have a volunteer interpreter. We have seen an increase in our Hispanic Latina families that are coming to the program. And so we offer interpretation services, and that's made all the difference because one of the things we do is when a parent has given birth and had their baby, they get to come back and tell their birth story. And so we have that interpreter there on site that can help our teens share that story with everybody and feel connected to everybody else at group. So
incredible program. And we thank the food bank for giving us the space each week, because it's a lot. When you think about 15 to 20 young people, plus their support person, plus a baby, plus everybody's coats and their car seats and a diaper bag, we like take over the place. I just had to paint that visual because it's a lot to coordinate and it's a lot of services, but every week, you know, they are coming back for those services. So it's a great feeling to provide that.
it is. So for our friends on the presentation today who like numbers, when you look at these two charts, we're looking at teen births in this county and also our rate of STDs. We're looking at teen births just in a 10-year time span here. And so just in 10 years, you can look and see we went from 100 teen births in 2013, which at that time we were thrilled about, to go down to that from 264 to then we had some years where it went up a little bit, but then to be looking at we're a little under 50 in in the most recent data in 2023.
Can I hop in really quick? Hop in. I'm just a hopper today.
Yeah.
If you could imagine that scale with 264 on the left side of that scale, that's the impact that all of us have had when we create these programs together. That's a community success right there, and it affects so many societal issues. Yeah, I needed to hop in and say
Good.
that.
Absolutely. Our rate of STDs in this community, as you can see, we have a high rate of what's considered reportable STDs, which are chlamydia, gonorrhea, and syphilis. And that actually has gone down. The numbers have gone down since 2021. But for many years, our county has been #1 in the state for these STDs. We're like #3 and #5 for those three listed STDs on this chart. But we put these charts together because this tells a story. So if you think about if our teen birth rate is as low as it is, and yet our STDs are as high as they are, we need to be talking about and ensuring that we're providing education about correct and consistent condom use. and also resources on where condoms are located. And making sure we're educating young people that, you know, if you are sexually active, condoms are the only method of birth control that prevent STDs. So a lot of, I shouldn't say a lot of times, but we do have students that will initially come in to our individual health service and they're concerned about pregnancy and not STDs. And so our counselors are talking with them and saying, well, you know, if we're going to test for pregnancy, maybe we need to test for, I'd like you to consider getting tested for STDs as well. And we will find that students who initially weren't concerned about STDs when they came in initially are positive for them. Our number one symptom for an STD is no symptoms at all. And so our educators are teaching about that too. So we just wanted to kind of show that visual.
Just noticed the time. How much time do we have, Paige? I just noticed the time.
Yeah.
No,
Wow.
that's okay. If we could do, maybe like 10 minutes of Q&A at the end, that's great. So,
Okay.
Okay, so how much time do we have presentation wise?
yeah, so about 10 more minutes.
Okay,
Perfect.
all right.
So this is, and you can see this here, this is a list of incredible funders at the state and local community level and individuals who, I mean, literally, if we didn't have this list of support, we wouldn't be doing these programs. And so really, thank you.
So we're gonna switch gears a little bit. So get your pens ready because we're gonna scoot through this in, 7 or 8 minutes that we have left and then answer some questions. As you can see, that she's our glue girl. So we are so thankful to have Brooke. She does a lot of things behind the scenes to help pull in our funding and work with our community funders. So we are able to do all of these services. So kudos to you.
Thank you.
Let's talk a little bit about Success Street. Success Street is that, I know I use the umbrella term a lot, but Success Street is an umbrella of community resources and services and programs that connect our youth to enhance their wellness, help them successfully learn in school and prepare for life. So that is our mission. And we want to bring all of those services to the students that are in our schools. So what we've seen when we provide all of these services under this umbrella in our schools is that we are seeing increases with grade point averages. Attendance goes up with our students. School engagement increases and behavior referrals go down. So when a student walks in our doors, we know that we want to link them to whatever services we can. So we have, oops, oh,
I'm sorry.
that's all right. So we have created this program. Gosh, Brad has been working at this for over 30 years. We've got to give kudos to Brad. He has created this program and he worked with Rhonda Bodke, just to throw a name out there if any of you know who Rhonda Bodke is, and Arlene Prather-O'Kane and Georgine Wagner. Those are some names that were back in the early days when Success Street started. And since then, we've been able to really grow the programs here at Success Street. We're going to talk a little bit about the environment that we create. I'm going to try and skip through. I know that we're short on time here, but create a really safe environment. Whoever works under this umbrella needs to be youth friendly. We want to create a safe environment so they come back, they tell our friends. Our teens are our best marketers. So if they have a successful experience at Success Street, we know that we're going to have their young people or their friends come back and utilize our services. Yeah. The services that are confidential, we'll talk a little bit about, and I think Brooke touched on this too. When we provide a confidential service, such as a pregnancy test or an STI test or a screening with our Pathways facilitator, those are confidential services, but we want to make sure that adults know that one of the first things that we talk about is who is your trusted adult? Can we role play a conversation to bring that up? And yet we still provide those services. Here is, I'm going to scoot through some of these slides here, but this is who we are. We're offered at 3 locations. We're open during school hours, Monday through Friday.
And I want to say too, with those 3 locations, which is East, West, and Carver, as you saw on the slide, if a student does not attend those schools and still, and wants some of the services that are offered under Success Street, we do have providers that will take that service to the school.
Mhm.
So for instance, today, we were at Cedar Falls High School. They don't have a definitive Success Street site, but we've been doing work and meeting with students within those walls as well, and offering mental health counseling through Black Hawk Granny Mental Health at all the schools,
all the
whether
schools.
there's a Success
Yeah.
Street or not.
Definitely. I think of last week, we were at Hoover, Bunger.
Yeah,
We were at several schools that weren't on,
Central.
that don't have sites, but we coordinate, and that's another thing, coordinate, community, collaboration. We have to coordinate, when services are offered offsite, it's a little bit more work because you have to find the person that has a confidential space, how we can reserve that room, but we do offer those services. So Success Street offers mental health assessments and programming. We offer that individual health and education support that Brooke had mentioned earlier in the presentation, confidential screening for STIs and STD treatment. Um, we have the Young Parents Program. So we have young parents that come in and meet with Jill and maybe ask, can you help me with diapers this week? Or I missed my doctor's appointment. Can you help me get scheduled? I missed my OB appointment. All of those different things. Um, if if someone's been sexually assaulted, or if someone is in an unhealthy relationship, we can bring Amani, Riverview, Waypoint into one of the sites and make sure that we have that young person meet with them and get the services and the advocacy that they need. We work closely with Pathways. We also are helping young people access medical care. So if someone needs an immunization or a sports physical, what we can do is say, hey, do you have a medical provider? No. Well, let's look through this list. Let's talk with your parents. These are the providers. Can we help you make a call? One of the things that I've noticed over years of being in this field is because young people are on their phones so much, a lot of young people don't know how to pick up the phone and
Yeah.
actually call and wait 30 seconds and listen to music and have the patience to do that.
And 30 seconds might be on the low end of
You
how
know,
long you have to wait.
Yeah. Wait a little while, have that patience, and then ask for what you need. So the skill of even helping a young person access medical care is a life skill that they're going to need for the rest of their life. You can't schedule everything online. And you have to share what your symptoms are. You have to look at your calendar. You have to have that available, and maybe what your insurance is. So that life skill is an important thing to be doing
Absolutely.
here at Success Street. Yeah,
I also think it's great too when a student comes down to Success Street to make an appointment in person, especially if they're coming down for that individual health service. I think
Mhm.
they may not want to verbally say, they might have the embarrassment with that to verbally say to our person at the front desk, who is very friendly. But we have sheets where they can mark on the sheet what service they're interested in and get the conversation going that way with our resource navigator at the front desk.
Sometimes it's not easy to ask for what you want, but we just make it a comfortable space. So even if they stopped in a couple times, then maybe their third time they'll ask for what they really need. I just am going to toss out. I recognize that we've been on for a little while here, and we probably only got a few minutes left. But there were 7,400 mental health sessions provided through Success Street last year, reaching over 650 students. So 7,400 sessions were coordinated in our Waterloo Cedar Falls schools for young people. And the things that they talk about with mental health services, it's just an array of things. It could be depression, anxiety, trauma, relationships with family, bullying, trouble with their peers, high risk behavior problems, stress. Um, all of those services are accessible under the Success Street umbrella. Um, so that's just one of the many services that we have. I think we had mentioned the Riverview Waypoint Amani. I'm going to flip through here really quick so I don't forget anything. The individual health and pregnancy prevention education, STI testing, substance use prevention with Pathways, and those are just to name a few. We have had DHS workers that come and ask to use space so they can meet with someone that they're working with. We want to make sure that we're accessible. Since the pandemic, we have noticed an increase. We want to talk a little bit about what we are seeing as trends in the last couple of years, an increase in anxiety and stress. So we want to make sure that we have all the resources we can for someone that just comes in and kind of tucks in the corner and sits down and looks at us like, I'm just so stressed out. I can't breathe. I'm having anxiety. Well, we have created these little packets that have like fidget toys in there, information and resources and sites that they can go to access resources to help them. We also created vaping kits this past year. Our principals and teachers and our safety officers are dealing with so many students that are caught vaping. And we could do a whole presentation probably on vaping, but we thought instead of them just getting in trouble and getting sent home, we wanted to provide a packet to them with some resources and education and a fidget toy, a mint, and different ways that they can help handle their stress. We also have treats here. We have granola bars. You know, we work with a lot of students on site that are food insecure. We want to make sure that they have something to feed themselves so they can learn. You know, no one learns when they're hungry and their stomach is growling sitting in their seat. So those are some of the things that Success Street is working on. I know we have these students, or we have these services for students, but we would also, you know, encourage parents to call. If you've got a friend or a circle of a community circle that you're involved with, and anyone needs resources on how to talk about these topics with their young people, encourage parents to call in. We want to make sure that parents have those resources because not all of these topics are easy to bring up. And you know, we want to make sure we're there for the parents also. We would really like to thank our community funders, Waterloo Community Foundation also. We would just really like to thank you for the support and this opportunity for us to present this morning. And
Absolutely.
Yeah.
Thank you.
let us know how we can help you also.
Yeah, thank you both so much. We do have a couple questions that have come in. So really quick, even thinking all the way back to when we were talking about the resource cards that you guys provide. What is the best way for people to get those each year?
You know
Make sure
what?
they're updated.
If you've got your pens handy, the number would be 319 433 2780, and you'd be connecting with the West Success Street site. And if you need 100 or 200 or 50, just let me know. Leave a message if I'm not here, or otherwise ask for me, and we'll make sure they get delivered. We didn't say the number, but we print. Our first print is usually about 5,000,
Mhm.
and then by the end of the fiscal year, we distribute 10,000 of those every year. And it's not like we find them out on the street or in the entrances or in the garbage cans. Kids really do tuck them in their pocket or put them in their phone case. So kids are using those.
And we've had young people we do every year that come into Success Street, and my friend gave me this. We go into all of the C3 classes in the Waterloo schools at the start of the year. And because a lot of times students, you know, they come into West or East or Carver, they don't realize that we have a Success Street. They have those services available to them. And so it's a presentation educating them about what's right in their own school. So
Thank you.
give us a call. We would love to get some what's right for teen cards to you.
Love it. And then we had a good and really timely question, I think, from Doug here too, just about, you know, we're in a shifting political climate, and some of the topics that we've talked about today, including like reproductive rights and sexual health education, and some of those things are topics that have been very prevalent in the last year or so. How do you anticipate having to navigate potential changes, or what do you kind of, as you look at the next year or few years, kind of what are your thoughts there about how maybe your programming is impacted or changes you'll have to make, anything like that?
Thank you for that question, Doug.
Yeah, we weren't prepared for it, but we are going to answer it. Well, maybe you were prepared for it, but what I'm going to hop in here and say is, with us being involved in these programs for 55 years combined, we have had some roller coasters And we've had some interesting rides along the way. What I will say that we won't do is to cave if we can. We are going to continue to do the best work we can and stay motivated to fight for young people to have the information that they need to meet their goals and get through high school without an unintended pregnancy, if that's what their goal is. And we're just going to continue to do the work that we do. We've been here a little bit before when we couldn't provide certain information to young people, which is, and we've been here before about 15 years ago when we had a push for abstinence only until marriage education.
Mhm.
So we've been here before, and I think one of our phrases over the years is that we need to be patient but persistent, and we need to make sure that we can still provide whatever programming we can within the parameters or the guidelines or the continuum that we can, and stay relevant, because we are not going to fold. We have to make sure that these services are available for our youth.
Absolutely. Mhm.
That's great.
So
We do have, so, like we talked about, we have funding through the state of Iowa that started this programming, our Community Adolescent Pregnancy Prevention Grant. And even, I mean, we could go back several years, but even in the last couple years, so like for instance, last year, we have a partnership with the University of Northern Iowa where we pre and post test students that participate in our programming. And unfortunately, some of the legislation with that was we weren't allowed to evaluate them last year. And this year we are allowed to evaluate them now, but it's a parent opt-in for that. And so if a school doesn't have a mandate in place on, like at the start of the school year at registration, a parent signs a form saying, yes, you can survey my student. We have a letter that we provide and work with teachers on to get to parents so they can sign off for their student to take our evaluation. Those results are important. And while that, we want to make sure we're doing the programming, but we also want to make sure we're evaluating students and seeing those outcomes too. So that's just a couple of small examples.
We have to tweak all of our resources and all of our PowerPoints and slides to make sure that they don't include certain organizations also, which would be Planned Parenthood, or any other organization that has to do with termination of pregnancies. So that isn't what we're here for. What we're here for is to help young people avoid those things. And I think that's what we can all agree on, is we want to make sure that young people have the information and the guidance and a trusted adult and programming that they can trust, so young people can get through their adolescence without experiencing an unintended pregnancy.
Thank you guys for jumping in on that. And thank you, Doug, for a great and super timely question too. That's what we want this place to be, a place where we can talk about these things and hear from people that are directly impacted by some of these things that the rest of us hear about.
Check in with us at the turn of the year.
Yeah.
Oh, 6 months down the road.
Yeah. And, make sure you check on us, because it is going to be a challenge, and yet we have never wavered. We just want to make sure that these services, so you can depend on us, that we're going to do all we can to make sure that as many services are continued in this community that we can.
And I think that's where you talk about how important the relationships that have been built over the years with you guys on the call, Waterloo, the other counties and schools that we serve. That's where those relationships are so vital to what we're doing, and the relationships with the students.
The correlation, I think our community has experienced 35 years of, as our programming has increased, look at the significant decline in teen births. And when you address teen births, you're able to help them reach their goals and their lifetime earnings. And again, the societal issues that we're all working on with all these programs in the community. So anyway, Robert, did you have a question?
Yes, I am just learning about your organization. Are you a
Oh.
separate 501c3 entity?
So we are a 501c3 under our organization is Success Link. And that is who holds our 501c3. So we are a nonprofit and there's different programming under Success Link. And so that programming includes the Together for Youth programs and then also Success Street, which is our school-based health services.
Well, I'm always interested in the details. How many employees do you have, or do you have employees?
Well, employees, as far as who's employed under Success Link, that's 7 or 8 of us. But then if you start looking at the services under Success Street and the different entities, so like Black Hawk Granny Mental Health provides our mental health counseling under Success Street. Gosh, that's
Okay, that's good.
a large
What is
number
your
of
annual budget and where's your source of funding? You get government funding or donations? What?
Well, it varies. So, gosh, I wish Brad was here to answer that question. So Success Link again is that umbrella, and we have those 4 entities underneath. He gathers data. We also help other organizations contract to provide services in the community. Then we have Together for Youth and Success Street. So if you're asking about Together for Youth and Success Street, we can answer those questions. We do receive some state funding for Together for Youth, and then a lot of community funding. Success Street is a nonprofit and underneath Success Link. And I don't know if we do get state funding. I think it's primarily funded under the
community
community
funders
funders.
of schools.
Yeah.
And then the entities that are coming in and providing the services under Success Street, they're providing those services while they get funding from funders as well. They're providing those services in kind under that umbrella.
Do you have separate offices here in Waterloo or Blackhawk County?
We have 3 for Success Street. We have 3 offices where providers can come in, and then the services that are offered in the schools that might not have a Success Street site. We just coordinate with school counselors and school nurses and administrators for office space to provide all of those services that were listed in those schools. And then Together for Youth has a few offices over at the Success Link office for some of our health educators. We call them bag ladies. They carry all their curriculum and their surveys and their laptops, and they have 3 or 4 bags every time they're in and out. So we don't see them very often because they're in schools and youth serving agencies. Again, how many presentations did they provide last year?
Last year they provided almost 900 presentations in a 4-county service area. So when you ask where their office is, on the road, in the schools, youth serving agencies, Blackhawk, Bremer, Butler, and Buchanan counties are where they're doing those programs. That's a great question.
Yeah, that is.
Well, we are getting over our time here, so I am going to cut us off. But if anybody, I'm sure that these ladies would be happy to talk more. If you have other questions that come up, feel free to get in touch with them. We'll send out links to their websites too, we'll send out a recording of this presentation, and we'll include some links too, so that it's easy for you to learn more, get connected, and potentially support if that's something that you're interested in. We want to make sure that we have those resources available to you too. So Joni and Brooke, thank you so much for joining.
Thank you
us
for
and
this
sharing
platform.
So much. You
Really.
guys provide so many resources in our schools.
Thanks.
It's a lot, and we appreciate your great work and for taking the time to share more about it with us today.
Thank you for your partnership.
Yeah,
And thanks for the great questions.
Yeah,
today.
those were great.
Yeah. Yes, thank
We
you.
will
for-
also send you, we have new annual reports for Together for Youth and Success Street. So if you want to get those sent out too, we can get those to you in the next day or two.
Yeah, that'd be great. That'd be great. Send those to me. I'll include those in our follow-up email as well.
Thank
Awesome.
you.
Well,
Thanks,
thank you
everybody.
all so much for joining us. Have a wonderful
everybody.
holiday season, and we look forward to seeing you in 2025. Thank
Bye.
you. Bye-bye.